Welcome to another episode of Health Check, a series of health podcast specials on the status of Singapore's war against diabetes that the Straits Times is running together with reports as well. I'm Joyce Teo, a correspondent with the Straits Times, and my co-host is Ernest Luis, the head of podcasting. Our special guest today is Dr. Ben Ng, an endocrinologist at Mount Elizabeth Novena Hospital. He's here to talk about gestational diabetes. So hi Dr. Ng, welcome to the show. So tell us, should pregnant women worry about gestational diabetes?
I think in a simple answer, the answer is yes, we should worry about gestational diabetes. We have to understand, in Singapore, 1 in 5 ladies can develop gestational diabetes. And having gestational diabetes significantly increases the health risks to the mother and child, both during pregnancy and following pregnancy. But I think let's take one step back first and ask ourselves, what exactly is happening in gestational diabetes? We have to understand, when a lady is pregnant, there are a lot of hormones going around, and all these hormones together requires an increased amount of insulin. Now, in simple words, the lady is building a baby. That's a huge physiological stress. And during physiological stresses, the body needs to produce a lot more insulin. Now, when the body is taxed, when you say, oh, I need more insulin, not everybody can match this demand. And as we know, insulin is required to lower your blood sugars. Now, is there such a huge demand to build your baby, such physiological stress required? There's less and less insulin for the mother and more taken up by the baby and the processes to build this baby. And what happens then is that the body's sugar level starts to go up. And that is the essential problem. The essential fact is that in gestational diabetes is a physiological stress, and the mother cannot cope with this physiological stress, leading to higher blood sugars. And this, of course, leads to worsening health outcomes.
So actually, Dr. Ng, it's important to know that this episode is not just for women who are pregnant right now, who are considering these factors, but it's also good for people who are thinking of conceiving, that they should also listen in to this episode as well.
Absolutely. I think the current recommendations in Singapore now is that any lady who's pregnant should be screened for gestational diabetes between weeks 24 and 28 of pregnancy. And it's very important because we talk about, oh, it's so dangerous, it's a problem and so forth. But we have to realize that with correct management, and that's not just necessarily with medication, but with changes in diet, changes in lifestyle and so forth, it can lead to a much better outcome for both mother and child.
Can I ask you this? Many women have the misconception that gestational diabetes won't happen to them as long as they do not have any family history of diabetes. Is that true?
Unfortunately, I think that being Singaporean is a risk factor for gestational diabetes already.
Okay.
I think that unfortunately we know that diabetes is a significant problem in Singapore. And I know I was joking about Singaporean being a risk factor, but I think our lifestyles and all that sedentary lifestyles and all that predispose the development of gestational diabetes, and unless your lifestyle is extremely different, you are at risk if you stay in Singapore. Other risk factors such as pre-diabetes before pregnancy, being overweight, having a history of polycystic ovarian syndrome, and other medical problems can all predispose you and increase your risk of gestational diabetes. And that being said, some ladies have no risk factors whatsoever, and they can develop gestational diabetes as well. So I think it's very, very important to realize you can't escape from this, and it's probably better just to get screened because it's something easy to do, easy to test for, and more importantly, very, very treatable.
So, as you said, it's important that all pregnant women are encouraged to be screened during week 24 to 28?
Yes, that's right. I think that if you are at increased risk, speak to your doctor. There is a chance that we may want to screen you even earlier if we think they're at increased risk of developing diabetes, but it's something you should talk to your doctor about, even if you're planning on getting pregnant.
Right. So, Dr. Ng, what is this Singapore lifestyle that you talked about?
I think the Singapore lifestyle that we all lead now is extremely sedentary kind of lifestyle. We tend to have less exercise, and we have so much access to food nowadays, and very good food, may I add. I think that contributes significantly to the development and the increased risk of diabetes. I think just on this level, I think it's important to note that gestational diabetes is not diabetes mellitus as we know it. Gestational diabetes is a condition where your blood sugars are abnormal during the course of pregnancy, caused by physiological changes and physiological stress during pregnancy. So even though your blood sugars can be considered, it's a little borderline for people who have overt type 2 diabetes, even the slightly elevated blood sugars in gestational diabetes can pose as health risks for mother and child. In other words, the standards we employ for pregnant ladies for sugar control is much stricter than that in type 2 diabetes that we know.
Right. But it's so I guess that's the misconception about gestational diabetes, right? That people think it's not serious because it will disappear once the pregnancy is over.
I think that's the biggest misconception of all. I think you're right in saying that the sugar levels do get better because essentially, as we spoke about earlier, the physiological stress of building the baby is gone. However, we must understand that once your body is tested and it can't manage sugars properly, anytime it's under physiological stress again, whether you have a heart attack, you get an infection, you get a broken bone, or the biggest physiological stress of all, as you age, your blood sugars may climb again. So I think the important thing and the message to anyone with gestational diabetes is that what has happened is that the pregnancy is a test, is a physiological test, and we didn't quite come out passing. And although the stress is over when the baby is delivered, the risk of you developing diabetes will always stay. I can almost assure you, any pregnant lady who is gestational diabetes, once you deliver the baby, your sugars will be better, full stop, because the physiological stress is gone. However, that being said, as you age, there will be the risk of diabetes in the long term. So my message to any lady with gestational diabetes is that although your sugars are normal, A, get yourself tested on a regular basis, minimum every 3 years. The risk of developing diabetes is there. B, although the sugars are normal, you are still at risk. Whatever lifestyle you are leading before you had gestational diabetes is contributing to the development of gestational diabetes or the condition you had. If you do nothing, the risk of diabetes increases significantly. You have to change your lifestyle, whether it's increasing your exercise, whether it's changing your diet, or doing a combination of all of that. Because if you don't, at the rate you're going, the risk of developing diabetes in the next 4 to 5 years is extremely high.
Is this the same as a pre-diabetes then?
Let's just say that pre-diabetes is probably one step in front of gestational diabetes, because in pre-diabetes, there's already a problem. The sugars have become abnormal. In gestational diabetes, in most cases, after pregnancy and after the baby is delivered, the sugar levels become normal. But the question is, normal for how long? We know that it's normal, but the minute you stress it, it's gone. It goes up again. In pre-diabetes, the levels are already abnormal. So I suppose in some ways, you can say that gestational diabetes is a pre-diabetes state.
Right, but in Singapore, what are the chances then of somebody getting diabetes if they have gestational diabetes?
I think the rates go up by 3 to 4 times if you have gestational diabetes. So again, it's an extremely high risk factor, and it's something we really, really have to be careful. It's again something we don't take lightly.
Is there an increased level of awareness you find among women today, especially those who come and see you in your profession, in regards to such topics?
I think with gestational diabetes, most people are surprised they have it. I think that's the first thing, but most of them are aware it's there. I think what we really need to educate the public is really, if you get gestational diabetes, many ladies after they deliver, because their sugars are normal, they say, oh, I'm okay now, everything's all right now. And the truth is, no, you're not okay. The sugars may seem okay, but the minute we stress you again, it's going to be abnormal. So you need to do something. You need to get yourself tested. You need to change that lifestyle of yours, because at the rate you're going, the risk of developing diabetes is extremely high in the future.
All right, thanks for your time, Dr. Ng. And if you do have any more feedback or questions on such health topics, do email us at podcast@sph.com.sg. And that brings this Health Check episode to an end. Thanks, Dr. Ng.
My pleasure.